Good day to everyone. My name is Dr. Piyush Panigrahy, and I'm going to be presenting a paper on imaging in epistaxis. My guide and co-author is Dr. Paridhi Jain. We are from the Department of Radiology, KIMS Hospital, Bhubaneswar. So, introduction. Epistaxis is a common problem that we frequently encounter. Although most of the cases are relatively minor and manageable with simple conservative measures, sometimes the condition can present as a life-threatening problem. The objective, it is identification of the cause and proper treatment of the same, which is vital in life-threatening epistaxis. Aim of this presentation is to depict a pictorial representation of various different causes of epistaxis and their management. So the methodology, we have made a search of epistaxis cases in the last 10 years, and I have compiled important different causes, their imaging features, along with their management. So the different causes of epistaxis can be traumatic, inflammatory, hematological, structural, neoplastic, and general. So under traumatic, there can be digital manipulation or nasal fracture due to any accident or foreign body stuck in the nose and iatrogenically induced. Inflammatory, there can be allergic rhinitis, acute infectious causes. In hematological, thrombocytopenia, hemophilia, von Willebrand disease, liver failure, and aneurysms. In structural causes, mucosal dryness, spurs, hereditary hemorrhagic telangiectasia, or septal perforation. And in neoplastic causes, benign like polyps, malignant like various tumors. Then general causes are medications like antiplatelet drugs, steroid nasal sprays, and hypertension. So let's look at the traumatic causes for epistaxis. Fractures due to road traffic accidents or trauma to the face can cause hemosinuses, which is filling of blood within the sinuses. In this case, we are seeing blood accumulation in the sphenoid air sinuses and maxillary sinuses. So we have two cases here, a 36-year-old male with history of road traffic accident presenting with nasal bleed, and a 23-year-old female with road traffic accident presenting with ear and nasal bleed. Then let's look at the structural causes. So a DNS with bony spur can also lead to epistaxis. Here we have a case, 21-year-old male with epistaxis with a postnasal drip. Then another case where we have multiple telangiectasias. So it's a 44-year-old female bleeding from nose for almost 25 years. Bilateral, starts spontaneously and lasts for 7 to 8 minutes. So on endoscopy of nose, we see multiple telangiectasias over nasal mucosa. The biopsy impression is telangiectasia. So treatment would be she underwent septoplasty with Sinec release, planned for empirical embolization of bilateral internal maxillary arteries for controlling the epistaxis, if necessary in the future. In inflammatory causes, we have 38-year-old male with complaints of intermittent anterior nasal bleeding for the past 4 days. Treatment will be right endoscopic sphenopalatine artery ligation with spur reduction. The biopsy impression is chronic rhinosinusitis. So there's soft tissue thickening along with the bony spur here, and there's mild mucosal thickening in bilateral maxillary sinuses in the case of granulomatous inflammation. Here there's a 43-year-old female with bilateral epistaxis and nasal obstruction. Treatment would be steroids. Then neoplastic causes in benign, chronic pansinusitis with sinonasal polyposis can be seen. So in this, we have a case, 49-year-old male with complaints of bilateral nasal obstruction and episodic epistaxis. So the treatment for this will be bilateral functional endoscopic sinus surgery or FES. So the biopsy impression here was benign inflammatory polyps. Then 64-year-old female with complaints of bilateral nasal obstruction, occasional epistaxis and headache. Biopsy impression came out to be antrochoanal polyp, and the treatment is bilateral functional endoscopic sinus surgery. So here we can see right antrochoanal polyp and sinonasal sinuses. We can see opacification of the right maxillary sinus. Then more neoplasms in benign. So a 64-year-old male came with complaints of minimal nasal bleed, right nasal obstruction for 2 months. Biopsy impression was benign angiomatous lesion. The treatment was planned for resection with assistance from plastic surgery unit. So here we see T2 stir heterogeneously hyperintense with hypointense areas within. T1 isointense mass in the right maxillary sinus and the nasal cavity. Another case of benign neoplasms. 46-year-old male with history of intermittent epistaxis and intermittent nasal obstruction for 2 years. The biopsy impression was inverted papilloma, and the treatment was left functional endoscopic sinus surgery. So here on the MRI, we see a T2 hyperintense mass arising from the left lateral wall of the nose with post-contrast enhancement and cerebriform pattern, which is suggestive of inverted papilloma. More benign neoplastic causes. So here we see another case, 16-year-old male with complaints of progressive left nasal obstruction for 4 months with bilateral nasal bleed for 3 months, spontaneous in onset and almost 20 ml in volume. So the biopsy impression was juvenile angiofibroma. In the MRI, we see T2 hyperintense mass with flow void, no significant diffusion restriction, and intense post-contrast enhancement arising from the left sphenopalatine foramen. So the treatment would be embolization of the maxillary artery preceded by endoscopic excision of the left nasal mass. Then malignant neoplasms. So we have a 61-year-old male with complaints of left-sided cheek swelling for the past 6 months, watering of left eye, and nasal bleed for the past 4 months. Treatment to this would be left extended maxillectomy with infratemporal fossa compartment excision with left supra-omohyoid neck dissection with submental flap under general anesthesia. The biopsy impression came out to be squamous cell carcinoma arising in the background of inverted sinonasal papilloma. So the imaging findings are a lobulated lesion of soft tissue density centered in the left maxillary sinus with destruction of the walls of the maxillary sinus, alveolar ridge and zygomatic process, intraorbital extension along with floor of the orbit. So here we see a case of 48-year-old female with complaints of bleed from the nose for 6 months, associated with nasal block, treatment, endoscopic excision of left nasal mass under general anesthesia. The biopsy impression turned out to be olfactory neuroblastoma. In the imaging, we see enhancing mass lesion in the left nasal cavity extending from the inferior to the superior meatus, involving the left ethmoidal air cells, displacing the nasal septum to the right, widening the maxillary ostium and extending up to the left posterior choana. So in conclusion, cross-sectional imaging plays an important role in identification of the various causes of epistaxis. It helps in planning the management of the patient. Hence, proper knowledge of the various spectrum and its radiological features is vital. These are my references. Thank you.